desire. Danger, danger, high voltage.
Good morning.
Good morning, Maria. I heard you got something interesting today.
Okay. Thank you.
Danger, high voltage. When we touch and when we kiss. Danger, danger, high voltage. When we touch, when we kiss. When we touch, when we kiss.
God, she's wearing the kind of perfume that can even attract noseless doctors. Anyways, let's see. 25-year-old, prima para, 1-day status post-vaginal. Well, nothing unusual here. Oh, mom used cocaine during pregnancy? Well, at least I know what to expect now. Alright, come on. What do I remember? Right, neonatal abstinence syndrome, essentially withdrawal on the baby's side. What am I looking for? Signs of NAS, high-pitched cry, irritability, tremors, jittering, sleeping difficulty, stuffy nose, sneezing, feeding difficulties due to sucking problem. I guess tense arms, legs, and the back. Poor weight gain, vomiting, diarrhea, increased breathing rate, skin irritation. So, if I see a combination of those, then a diagnosis of NAS can be established. File says coke. It's direct stimulant. Commonly seen symptoms are in the first 72 hours, so I guess I'm lucky enough to be assigned to this file right in the window of time. Man, where's my coffee? Okay. So, with coke, I'm looking for tremors, high-pitched cry, irritability, excess suck, hyperalertness, apneas, tachycardia. Okay. File also says parents indulge in ganja. They drink too. God, these guys are better loaded than our pharmacy. Ethanol withdrawal starts at 2 to 12 hours after birth. So I should see some irritability, restlessness, poor feeding, crying, and impaired neurobehavioral functioning. Good morning. My name is Maria. I'm gonna be your nurse for today. I just wanted to stop by and see how you're feeling. How's mama?
I feel horrible. How would you feel? I just had a huge watermelon come out of me. I want my morphine now.
Yeah, dude, she's being a huge pain in my butt.
You better watch yourself.
I'm sorry,
Oh,
baby. You
Lord.
being cranky makes me cranky.
Did I turn off the stove this morning? I need to pick up some eggs.
I'm so sorry to hear about your pain. I'm definitely gonna check with the doctor about that order, okay? And for now, I'm gonna take assessment of your baby. By the way, have you named your baby yet?
Yeah, I want to do something traditional but fancy, like naming it after a city like Paris, but I was actually thinking Calabasas.
Or Long Beach.
Why not name him Valley Village then?
I think Calabasas sounds very lovely. Okay, so let me do the assessment on the baby. Real quick to check on
Quit
him.
having all the coke. Do you think it grows on trees? It grows on bush. I mean, I lost my train of thought. Why did they call it a train of thought? I'm really hungry.
I have something in my purse. Something, hamburger from last week. You want some? You want to share?
Yeah.
Okay.
We'll get it later.
Okay.
Oh, Боже мой, poor kid. Let's see what we got here. And that's why you shouldn't do drugs when you're pregnant. Okay, other than my standard head-to-toe assessment, I should use a Finnegan scoring system. I remember Kim was telling us about it. It's a good help to see how bad the withdrawal is. Let's see if I remember. Right, 20 most common signs grouped into nerve, state, respiratory, and gastrointestinal. 1 point for least potential for adverse effect, and 5 points for most potential of adverse effects. If it is 8 or more points, then I'll need to notify MD for the need of pharmacological intervention.
Your baby is showing some signs of withdrawal. I'll have to notify MD to see what kind of therapies we can do. And meanwhile, I'll definitely will check on your morphine.
Cool, but the baby just won't stop crying. What should I do?
Well, there's a couple of things that you can do. We can definitely, we can do some gentle handling with the baby. Definitely continue to breastfeed. Maybe some noise control. Let's keep it a little bit quieter in here. Swaddling is good. And, just for severity of withdrawal, just continue to breastfeed. I think it would really help. Okay, I'll be right back.
What is swaddling?
A type of fish, duh.
How do you do
Good
this?
morning, Dr. Kevorkian. Family in the room 223 needs some orders. Could you please help with that?
Good morning, Maria. Is it urgent? I need to
Well,
go
it's
over
pretty
Nina's
urgent. The newborn is really showing some signs of withdrawal. He's very irritated, he's crying, he's the works, We just really need some supportive therapy.
I see. Okay.
Okay. So doctor, what else? You were saying that we can do what kind of therapy?
Just some supportive therapy, something along those lines. I'll figure something out. I'll write down some orders.
Good morning, doctor. Maria.
Hi, hello there, Miss Striper.
Hello there, doctor.
How are you?
Doctor, I was saying about the assessment about that room, 223.
Yeah.
So my assessment of the newborn shows that the baby has experienced some withdrawal symptoms, and also mom was asking about some morphine.
Yeah. Okay, I'll order the meds and continue monitoring some supportive therapy. And Miss Striper.
Yes, doctor?
Could you please go into room 223 and assist the mom for her pain management and whatever else you may see fit?
Sure, doctor.
I need to pee.
Excuse me,
Yes,
doctor.
ma'am. Yeah.
Anyways, I'll continue with the regimen, okay, and I'll follow up on that. Also, I believe that we might require a course of oral, morphine sulfate or something for a newborn, maybe some benzo. What do you think?
Yeah, let's start the baby off at, let me think. I think we could definitely start the baby off at 0.2 milligrams per kilograms every 4 hours. Okay? Let's do that.
I'm not sure about that, doctor. I believe the recommended dose is 0.08 to 0.1, so it might be a little bit too high. What do you think?
I knew that. I knew that. Yeah, let's I guess we can just start from 0.04 milligrams per kilograms every 4 hours.
Without nurses, this place would fall apart or become a morgue. I need to pee.
Alright then, so it's settled, right?
Yes.
Okay, Maria, we'll go on ahead and start with doing that. We'll figure out the rest with the patient, alright?
Thank you, doctor.
Miss Striper, can I have a word with you?
Yes, doctor?
I'm very disappointed with your performance recently. Very. I think you need to shape up.
I do? I'm sorry, doctor. I'll work harder at it.
I'm sure you will, but I think we need to perhaps meet after work today to discuss your improvements and performance.
I'll definitely think about that.
No, you should meet me at this bar. Miss Striper, can you please call surgery and have them x-ray Miss Nunez? If they ask why, tell them it's a matter of time.
Of course.
Paging Dr. Kevorkian to surgery. We found your watch. We found your watch.
Oh, crap!
you guys. I just spoke with the doctor and unfortunately we have to wait on your morphine a little bit. Is that okay?
That's okay. I'm okay.
Okay, that's very lovely.
Oh my god, my phone is calling. Aló?
Um,
Aló?
Anyway, I just wanted to give you a little bit of information because you did express some kind of interest in having more children. Is that right?
Yeah, I want my next one to be planned tonight.
Пиздец детям. I still need to pee. They need to
Anyways,
shut up.
I understand that you are interested in having more children. I just wanted to let you know that alcohol is the only drug known to cause significant birth defects. Opiates can cause intrauterine growth restriction, spontaneous abruption, preterm delivery, stillbirth, abruptio placentae, and meconium staining. Cocaine and methamphetamines may have long-term effect on neurodevelopment.
Wait, who is she talking to?
Yeah, it's like she's talking to an invisible camera.
Our expected clinical course will include observation of the baby, scoring for signs of withdrawal, assessment differentiation between mild and severe symptoms, and interventions according to that, and preparation for long-term therapy that may last for some months.
What about breastfeeding? I don't want to breastfeed. I heard it tastes like bad yogurt.
About breastfeeding, well, you can continue to breastfeed as necessary. The concentration of common narcotics is very low in human milk. It is also very normal if you feel anxiety and guilty about this kind of situation.
The nurse should also show some empathy and conduct oneself in these situations without a judgment. Okay, maybe not with these guys. Also important, the maternal psychosocial status should be considered before discontinuing or changing the mother's medications.
Good morning.
Good morning.
Hi, everyone. How are you doing? Hi, Maria. All right, so I want to find out how your pain management is doing, and I want to discuss about your diet since you are a new mom, and if there's any assistive service that I can help you with to transition from being a mom.
Diet? What diet? I need to look good as I did before I got pregnant.
Pre-pregnancy weight? Yeah.
All I'm gonna eat is crackers and Coke. Diet Coke, that is.
Okay, great. Well, I see that Maria has everything under control, so inform her about the social service and any additional transition that they need, and notify them about the baby seat. Anyways, I gotta go.
Sure.
Thank you.
Well, all right. I see that we pretty much covered everything you need to know. Do you have any questions? How are you feeling about it?
Gosh, I can't believe you're still talking. I thought we were done with this conversation.
Whoa, dude, the walls are melting.
I'm screwed.
Oh God, what a long day. What a pair of yo-yos. But I believe they got the teaching and they'll be okay. Did some good work. Oh crap, I forgot to pee.
Work it, make it, do it, makes us harder, better, faster, stronger.